So Maxine Sun from University of Montreal Health Center. We did a study that will be published in European Urology shortly. It's on the importance of active surveillance, which has increased in recent years for the management of patients with localized renal cell carcinoma. So what we did was we wanted to examine the trade-offs of cancer-specific mortality and other cause mortality in patients treated with either partial or radical nephrectomy versus active surveillance. So to do that, we looked at the SEER Medicare database, and retrospectively we identified patients with no negative T1 renal cell carcinoma treated with either nephrectomy or active surveillance between the years 1988 and 2005, and we had approximately 11,000 patients. We primarily assessed both cancer-specific and other cause mortality simultaneously using competing risk regression analysis. We also adjusted for measured and unmeasured confounders using instrumental variable analysis in order to account for the treatment selection biases. And primarily what we found in the unadjusted survival outcomes is that there was a significant protective effect in terms of cancer-specific mortality in the overall cohort for nephrectomy versus active surveillance. Now, this trade-off needs to be weighted against the risk of other cause mortality because both for partial and radical nephrectomy and active surveillance, the risk of other cause mortality was detrimental. And also what we found is that in sub-analysis restricted to patients older than 75 years old, this benefit was no longer statistically significant in terms of the survival benefit with respect to cancer-specific mortality. So the current findings of this study shows that it's very important to adequately select surgical candidates, as our results show that some of these patients do not live long enough to benefit from surgery. At the same time, the dilemma persists as we are unable to differentiate between those with an aggressive disease phenotype and those who need immediate nephrectomy. So the current results at the same time corroborate existing guidelines which recommend active surveillance in patients with limited life expectancy. Thank you.